you so much, sir.
Thank you, Virishji. And before starting the talk, I always want to know what the audience is like, so that we can gel with them and gel with their ideas. So, how many people from yoga we have here? Thank you. From here onwards, we'll call it yoga. And how many people from Ayurveda? Oh wow. How many people from the industry? Software? I'm here. I am the Managing Director of Hospital and Institute of Integrated Medical Sciences. I don't know how many people know about it. HIMSS for short. We have chosen this name HIMSS for a purpose. It is HIIMS. What happens is, it sounds similar to AIIMS. कल को अगर AIIMS से किसी से मुलाकात हुई और उनसे बात हुई, तो वो बोलेंगे ना कि हमने तो 1 लाख पेशेंट देखे हैं डायबिटीज के. तो हाउ डू वी कंपेयर? मैं तो बोलूँगा मैंने तो 100 देखे हैं, लेकिन 100 ठीक किए हैं. आपने कितने देखे हैं और कितने ठीक किए हैं, ये बता दीजिए. 1 लाख देखे हैं तो ठीक कितने किए हैं? सो इट डज नॉट मैटर कि आपने कितने देखे हैं, आपने किया क्या है. सो अनलेस वी इंटीग्रेट ऑल फॉर्म्स ऑफ हीलिंग, we are not going to come to a conclusion as to how to deal with a patient. So if a patient is there, even if it is cancer, how do we deal with cancer? आज के दिन में bilingual is okay or English is fine?
I think English will be better because there are some people from South India.
All right. So whenever we say cancer, each and everything stops, especially for that family where somebody has been diagnosed with cancer. Till date, we might be sounding big, we might be doing big conferences, we might be doing n number of things, but we are not yet able to curtail cancer even one bit. If you look at the history of cancer, the fight against cancer started in 1970. When Nixon was the president, he said Second World War is over, now the war is on cancer. So it started from there, and till date, we have done everything. But we are back to the same place where we started from, because we are not being able to do anything as far as cancer is concerned. We might talk big that we are doing surgery, radiotherapy, chemotherapy, this, that. Are we able to cure a patient? No. Can any oncologist, if he's there in the room, I'll be very happy to interact, stand up and say that one patient out of the millions that he has seen, he has cured? Can he say that? If the patient gets cured, unfortunately it's called spontaneous remission. We don't know how it got cured. So this is where we are as far as cancer is concerned. So this is an area of interest also, and I take special interest because I'm a radiologist. So I do all the CTs, the MRIs, the ultrasounds, the PET CTs, and the gamma camera scans. So I would understand any disease and many diseases for that matter much to the same tune as their specialities. Like when we are talking to a cardiologist, we have to know cardiology inside out. Otherwise, he will bang the phone down. If I am talking to a neurologist, I have to know the brain inside out. So the radiologist's job is a tough job. Nonetheless, 50% of our work is cancer work. It did not start like this. It started very differently. But today, 50% of the... And epidemiological studies say that cancer 4 months earlier has overtaken heart disease as the major killer in the world. So cancer is the major killer today. The major killer, and we have no answer to it. When people say, no, we have got this, we have got that, then I need to digress from English to Urdu to say, Jannat ki hakikat hame bhi pata hai Ghalib. दिल बहलाने को ये ख्याल अच्छा है कि आपके पास कोई ना कोई टूल है. So we are doing a lot of things as far as cancer is concerned. Can I have my next slide, please? So we consider a cancer as there are three phases to it: Daihik, Daivik, Adhyatmik, physical and the metaphysical. Whatever we are seeing as a cancer is the physical aspect. What we are seeing on an MRI, on a CT scan, on a PET CT is the physical aspect. We are ignoring the metaphysical. Till the time you correlate both, you will not be able to cure cancer. आज के दौर में, even till date, to stop cancer where it is a miracle in itself. It's a miracle. If we stop the cancer there, it's a miracle. If we make the cancer take a U-turn, it's a miracle in a miracle in a miracle. If we make the cancer take a U-turn and clear it off completely, it's out of the world. And this completely cured, we have done more than 17 patients as of today. 17 patients have been cured of cancer completely. There is no, the 17th patient I got the PET scan done and the report today from the US. So they have sent and we have cured them. No, we have not. That is a very wrong statement to make. The patient who cures, the one you can see in the mirror is the one who cures. You will cure yourself. What we do is we empower the immune system to cure. And what is the immune system? It is not out of place to mention here. Some people, like Viresh ji was saying that, he's not a religious. I'm religious. I'm religious, absolutely religious. So whatever आपकी पूजा पद्धति कुछ भी हो सकती है, कोई भी आपकी पूजा पद्धति हो सकती है, लेकिन हमारी पूजा पद्धति में ब्रह्मा विष्णु महेश का महत्व है. Now, if I were to ask you, like for example, वाहे गुरु आपको कहाँ दिखते हैं? ये गुरुद्वारे में होते हैं क्या? मस्जिद में अल्लाह का वास है क्या? मंदिर में भगवान होते हैं क्या? चर्च में गॉड को किसने देखा है? गॉड इज सिटिंग इनसाइड यू सर. बाहर कहां ढूंढ रहे हैं आप? आपके अंदर बैठे हैं, आप बाहर ढूंढ रहे हो उसको. हाउ? आपके अंदर ब्रह्मा विष्णु महेश, मेरी पूजा पद्धति ऐसा बोलती है, ब्रह्मा विष्णु महेश मैं आपके अंदर दिखा दूंगा. The moment the child comes out of the mother's womb, the first interaction through the birth passage, there is a black thing that is all over, जिसको साफ किया जाता है. That is the bacteria that started your life. Brahma, life has started. That same bacteria manages you throughout your life, Vishnu. And when the person is dead, that same bacteria, वो उसको गला के पंच तत्वों में मिला देते हैं महेश. सो ब्रह्मा विष्णु महेश इज सिटिंग इनसाइड यू. बाहर कहां ढूंढ रहे हैं? दिस इज कॉल्ड द माइक्रोबायोम. द माइक्रोबायोम, नो टॉक इन द वर्ल्ड ऑफ modern medicine is complete without talking about the microbiome these days. Last 6 to 7 years, it is going to catapult the way we think about medicine. That is the microbiome for us. So for an introduction, what is the microbiome? I will tell you. You are made of 100 trillion cells. 100 trillion. Out of that, 90 trillion are bacteria, virus, protozoa, yeast, mucor. Only 10 trillion human cells. So each and every person is a bacterial colony. And still we are taking antibiotics. Antibiotics means anti-life, antibiotic. So you are killing 90% of your bacteria by taking antibiotics. Instead, you should take prebiotics or probiotics so that, what happens is सैल्मोनेला टाइफी, लोग बोलते हैं टाइफाइड हो गया, तो टाइफाइड हुआ तो टाइफाइड का बैक्टीरिया निकाल देंगे क्या आप एंटीबायोटिक खा के? वो हमेशा रहेगा और वो रहना बहुत जरूरी है. It's important that pathogenic bacteria are there inside. Why? Had it not been for Pakistan, Indian army would not have been इतनी सशक्त नहीं होती, इतनी अच्छी नहीं होती. Indian army is so great because Pakistan is there. If Pakistan would not have been there, Indian army would not have been that great. Which is why pathogenic bacteria are required for your immune system to work the way it works. Do not kill them. Do not try to kill them always. Like in the recent pandemic, we saved more than 60,000 patients. Not one, not two, not 10, not 15, not 100, 60,000. Without using a single drug, without using anything for that matter. And we proved that is just child's play. आप इतने लंबे चौड़े हॉस्पिटल में लेके जा रहे हो, पेशेंट मर जा रहा है. The basic understanding of the disease process has to be there. If it is not there, you will not be able to cure it. So coming back to cancer, this Daivik, Adhyatmik. If I am against Viresh, if constantly in my mind is there that, this guy is overtaking me, I somehow want to fix him, I might not harm him, but I'm going to harm myself. This feeling will, in the physical domain, will produce a disease. And if you are looking at the disease only, if you're not looking at the individual, so it is important to cure the disease, it is important to cure the individual too. So unless you take both, ये परिपेक्ष में नहीं लेंगे, you will not be able to cure any disease for that matter. Whether you use Ayurveda, whether you use homeopathy, whether you use whatever, whether you use integrated medicine. So this approach needs to be there. This we realized after the pandemic when we dealt with so many patients. We realized this over time. It's not that, right from the very beginning we are doing something like that. Right from the very beginning, I am still doing radiology. That is there, and that is how we integrate. And that is how we plan to start courses in integrated medicine too, wherein the graduates from all fields of healing will be joining a postgraduate program of integrated medicine. We are in the last phases of taking permission from the Guardian, that is what they say, Medical Council of India, and the file is pending there. So we don't know what the outcome would be, but if it happens, we are going to launch it. So this is where we are as far as integrated medicine is concerned. And this is where we are as far as cancer is concerned. So we just talked about Daivik and Adhyatmik angles of any disease for that matter, especially cancer. Next slide please. So biotic and antibiotics I've already explained. Next slide. So you see the names of these countries. I'm sure many people are from there. Australia, America, Denmark, Canada. क्या ये alphabetical order नहीं है? These are the countries which have the highest death rates as far as cancer is concerned. Highest. So they call themselves developed? Yes, they must be. They are developed as far as diseases are concerned. So these should be the target countries if you are actually planning anything in integrated medicine. Because people have no answer, trust me. Since we are in the middle of doing it, we know people don't have any answer anywhere in the world. Recently I was invited to Patanjali by Ramdev, and there I saw they're giving milk. I want to ask people from Ayurveda too, milk, let us first give a scientific reason of what we are doing, why we are doing it, and what is the outcome. Just because it is written in scriptures becomes, एक किताब, thou shalt do this, thou shalt not do this. That is not a democratic way of looking at things. That is a dictatorial way of looking at things. What should be democracy is milk. 8.7 मिलियन स्पीशीज है. लेट मी आस्क यू, 8.7 मिलियन स्पीशीज. एक और स्पीशीज दिखा दीजिए जो दूसरे स्पीशी का दूध पीता हो. दिखाइए, दिखाइए. You show me one species. You cannot be an exception always to the rule of the cosmos. You cannot always be an exception. Number 2, 8.7 मिलियन स्पीशीज. एक और स्पीशी बता दिए जो अपना खाना पका के खाता हो. लास्ट टाइम आपने हिरन को पालक पनीर बनाते हुए कब देखा था? उसको कैंसर भी नहीं होता है, उसको ब्लड प्रेशर भी नहीं होता है, उसको डायबिटीज भी नहीं होता है. Why? So what is the message? आपने लास्ट टाइम हिरन को डिओड्रेंट लगाते हुए कब देखा था? उसकी नाभि में कस्तूरी होता है, वो आपकी नाभि में भी आ सकता है. आपको भी डिओड्रेंट की जरूरत है. आप मैसेजेस लेते नहीं, हम लेते नहीं है मैसेजेस. हिरन क्या करता है? दिन भर चौकड़ी. हिरन से तेज कोई जंगल में भाग नहीं सकता है, चीता भी नहीं. सबसे तेज भागता है हिरन, और उसकी प्यास कभी बुझती नहीं है. मृग तृष्णा कहते हैं उसको. मृग की तृष्णा कभी नहीं बुझती है. पानी पीता हुआ ही पकड़ा जाता है. इफ यू हैव सीन ये डिस्कवरी चैनल्स, हिरन को पकड़ना है तो पानी पीता हुआ ही पकड़ सकता है, नहीं तो नहीं पकड़ सकता है. So that's a challenge. It's trying to give you a message. दिन भर चौकड़ी मतलब आप सांस ज्यादा ले रहे हैं. दिन भर पानी पीना मतलब आप पानी ज्यादा ले रहे हैं. और ये जलवायु का ही खेल है. दिखाता हूं आपको कैसे. I prove it to you. You go to any hospital from Detroit to Delhi, from Connecticut to Chandigarh. You go to any hospital in the world, it houses an intensive care unit which houses sick patients. किसी को किडनी का प्रॉब्लम, किसी को हार्ट, किसी को लंग्स, किसी को लीवर, किसी को पैरालिसिस, किसी का एक्सीडेंट. कई तरह के पेशेंट्स, कई तरह की दवाइयां चल रही हैं सबको. बट वन थिंग इज कॉमन टू ऑल दीज पेशेंट्स. एक उनको ड्रिप लगा होगा और ऑक्सीजन लगा. दैट शुड गिव यू अ मैसेज. In all the patients with different diseases, one thing is common. There will be a drip and there will be oxygen. So what is the message? इस पेशेंट का जल और वायु ठीक नहीं है, इसलिए ये पेशेंट है. On the other end of the spectrum, health, yoga, morning walk, jogging, swimming, dancing, weightlifting, gymming. आप जो मर्जी कर लीजिए. आप क्या कर रहे हैं? आप सांस ज्यादा ले रहे हैं, सांस ज्यादा छोड़ रहे हैं. जब भी आप सांस ज्यादा लेंगे, प्यास ज्यादा लगेगी. आपने सांस ले लिया, पानी ले लिया, हेल्दी हो गए, नहीं तो सांस और पानी चढ़ाना पड़ता. So a thin line between health and disease is जलवायु. इसीलिए कहीं जाते हैं तो बोलते हैं मैं अपना जलवायु बदलने जा रहा हूं. जल and वायु in so many words. Coming back to milk. So there is no other species which has milk of some other species. There is no species like that. Mankind can never be an exception always to the rule of the cosmos. Never. The most intelligent species on planet Earth. बॉस, ये आपको खिताब किसने दिया? आपने कभी किसी कुत्ते को पूछा कि मैं ये सर्टिफिकेट ये खुद को देने जा रहा हूं that I am the most intelligent species on planet Earth? कुत्ते के सामने कोई चीज फेंक दीजिए, एक बार सूंघ के बता देगा खाना है कि नहीं खाना है. आपको आज तक नहीं पता चला क्या खाना है क्या नहीं खाना. हम आज तक ढूंढते रहते हैं. वी आर ग्रोपिंग इन द डार्क. वी डोंट नो एंड स्टिल वी कॉल आवरसेल्व्स. 2003 में जो सुनामी आया था, आई वांट टू आस्क, कितने जानवर मरे थे? जंगली जानवर. मतलब हमने जो जानवरों को टेम कर दिया उनको पागल कर दिया, वो तो खत्म है. कुत्ते की आयु 50 इयर्स है. 50 इयर्स. आपको क्या मालूम है? 14 इयर्स. कौन है वो कुत्ता? जो आपने पाला है. आप उसको भी कुक्ड फूड खिलाते हैं. अगर उसकी आयु 50 इयर्स से 15 इयर्स हो सकती है तो आपकी क्यों बख्शी जाएगी? बड़ी सिंपल सी बात है. क्या हम ये नहीं सोच सकते हैं? वी नीड टू थिंक दैट वे. एनीवे, कमिंग बैक टू मिल्क. सो डू वी मैन्युफैक्चर मिल्क? हम इतने साइंटिफिक हुए नहीं है. बकवास चाहे हम जो भी कर ले, हम इतने साइंटिफिक है नहीं. कैन वी मैन्युफैक्चर मिल्क? नो. No, we process it. There is a difference between manufacturing and processing. You take X, you take Y, and you make Z. That is called manufacturing. You take X and you produce X plus 1 or X minus 1, that is called processing. तो आप मिल्क को प्रोसेस करते हैं, मैन्युफैक्चर नहीं। मिल्क कहां से आता है? मिल्क एक मां से आता है, चाहे वो गाय हो, चाहे वो भैंस हो, चाहे वो इंसान हो। यहां पर माताएं बैठी हैं, उनको पता होगा दूध के आने में मां का कोई हाथ नहीं, दूध के बंद होने में मां का कोई हाथ नहीं। ये नेचुरल प्रोसेस है। नेचर इज ट्राइंग टू गिव यू अ मैसेज, मिल्क ओनली फॉर द चाइल्ड। यू आर नॉट टेकिंग दैट मैसेज। यू लुक एट अ चाइल्ड, 2 साल से छोटा बच्चा दूध पी के वॉमिटिंग करता है तो दूध नहीं निकलता है, दही जैसी कोई चीज निकलती है ना। 2 साल के ऊपर का बच्चा, मैं और आप दूध पी के वॉमिटिंग करके देखिए, दूध निकलेगा, दही नहीं निकलेगी। क्यों? There is an enzyme in the stomach called renin which converts milk to curd for digestion that is present only till the age of 2 years. माँ के पास 2 साल तक ही दूध होता है बच्चे को पिलाने के लिए, और चाहे वो जानवर का बच्चा हो, चाहे वो इंसान का बच्चा हो, माँ जिंदगी भर दूध नहीं पिलाती है। These are natural things. Why don't you connect the dots to come to a conclusion that you are extrapolating things कि दूध बच्चे के लिए, अरे गाय दूध दे रही है, बछड़े को गाय बनाने के लिए आप क्या बनना चाहते हो? Write it on a piece of paper. You want to become what? If you still want to remain human, do what a human does. And if there is anything apart from this, I am ready. Apart from the scriptures, let's talk about science. So we'll be scientific when we are talking about anything that we do or anything that is said in any speciality that is meant to heal mankind. All are welcome. We would like to integrate everything, but on a very, very scientific platform and a very scientific basis, wherein we won't take any biases from anywhere just because it is said in a scripture. Can you prove? Yes, science cannot prove many things. I agree to it. Science cannot prove. I remember the words of Nikola Tesla when he said that if science starts quantifying non-tangible things, science will make progress in 10 years what it has not made from the advent of mankind till date. जैसे for example, आप अपने बच्चे को प्यार करते हैं? अगर आप करते हैं तो वो अनसाइंटिफिक स्टेटमेंट, अनसाइंटिफिक है वो। कैन यू प्रूव इट? 2 किलो प्यार करते हैं कि 2 किलोमीटर प्यार करते हैं? बिकॉज दीज आर द पैरामीटर्स ऑन विच साइंस फंक्शंस. सो साइंस हैज इट्स लिमिटेशंस, ऑफ कोर्स, बट वी आर ऑन अ साइंटिफिक प्लेटफॉर्म एंड वी वुड डेफिनेटली लाइक टू take the scientific platform as a basis of what we are trying to promulgate. So which is why we named it HIMSS, HIIMS. So these are the developed economies. What is cancer? By definition, it is failure of apoptosis. Central nervous system has a control कि कौन सा सेल कितना मल्टीप्लाई कर सकता है. What cell can multiply how much? First of all, for a basic understanding of what cancer is, we'll start with, are we unicellular or multicellular? If I may ask the doctors, sir, are we unicellular or multicellular? Yes, sir.
We are unicellular and converted into multicellular.
Oh yes, fantastic. That's right. So we started with a zygote, a sperm and an ovum fused to form one cell that is called a zygote. And non-sexual reproduction happened, because whenever we say sexual reproduction, that means 2 different individuals. If it is reproduction from one cell, it is called non-sexual reproduction. So from one zygote, you are made. So how do you feel? So many times when the nephrologist says ये तो किडनी का प्रॉब्लम था तो हार्ट कैसे फेल किया, मैं बहुत ये बेसिक अंडरस्टैंडिंग की बात, आप क्या बात करते हो, आप क्या बात करते हो? Each and every cell in the body is connected. Each and every cell. So this disconnection happened because हमें सब चीज काट के चाहिए. English में when you speak in English, you will say brain is what? Intelligence. When you speak in Sanskrit, एक तो संस्कृत का कोई पर्यायवाची शब्द किसी दुनिया के भाषा में नहीं है, किसी भी वर्ड का. We'll see to it. If we speak in Sanskrit, we'll say the brain consists of almost 128 parts. For the ease of understanding, we can say 4 parts. Man, buddhi, ahankar, chit. Man is what? Will. Buddhi is what? Intelligence. Ahankar is what? Your geopositional status. Where you are, आप कहाँ पर बैठे हैं, क्या बात कर रहे हैं, फ्रेंड्स के साथ क्या बात करना है, पेरेंट्स के साथ क्या बात करना है. So your geopositional status is your ahankar. And chit is the memory. The memory again is innumerable kinds of memory. The dharmic memory, the karmic memory, everything is stored in your chit. You just need to take it out. How I know so many details? Because I am doing a PhD on the pineal gland. So since I am doing it on the pineal gland, most of the things that I say, I would have already either proven it scientifically or in the process of proving it. So, all these things are there. That is how you categorize the brain. बुद्धि अगर बुद्धि के पार न जाए, ये बात वेस्टर्नर्स को समझ नहीं आती है. बुद्धि के पार बुद्धि कैसी जाए, बुद्धि के पार कैसे जा सकती है बुद्धि? इसके लिए you have to go deeper into the Indian philosophies of Sankhya Darshan. There are many darshan. Darshan is what? Yes, but again, darshan is a Sanskrit word and philosophy is a Greek word. Philosophia, love for books. पोथी पढ़ पढ़ जग मुआ, पंडित भया न कोई.
How you see it?
Yes. सत्य के दर्शन होते हैं. भारत में दर्शन शास्त्र है. सत्य के प्रत्यक्ष दर्शन होते हैं. और विज्ञान इज नॉट साइंस प्लीज. विज्ञान इज विशेष ज्ञान. You take सामान्य ज्ञान from these 5 senses. You take सामान्य ज्ञान. You with your knowledge that already exists, with your chit, with your memory, you process that gyan, and the conclusion that you reach is your vishesh gyan. That is not science, that is not vigyan. I mean, that is vigyan, but science is different. So which is why I told you, no word in Sanskrit, उसका कोई पर्यायवाची शब्द दुनिया के किसी भाषा में है ही नहीं. So, nonetheless, so what happens is one cell multiplies into 2 into 4. So there is a process where it stops. This is called apoptosis. Once apoptosis fails, cancer results. So this cell keeps on multiplying, keeps on multiplying. It does not obey the orders of the body, which is why whenever you eat something, cancer grows and the body decreases. That is what happens as far as cancer is concerned. It's a hyper-metabolic cell. I want to ask you, since this cell is a terrorist cell, in modern medicine, we are on the kill phenomenon. Kill the terrorist. Surgery, काट के निकाल दो. Radiotherapy, जला दो. Chemotherapy, poison it. We are on the kill phenomenon. Terrorist को kill करके terrorism मार दिया क्या हमने? So this is never going to be effective. If you always do what you have always done, you will always get what you have always got. You have to do something different than what usual means are, which is why we are not being able to cure cancer. We have to attack the philosophy of cancer. Unless we do that, एक बहुत अफसोस है मुझे that one patient we worked so hard on, a 35-year-old lady with a stage 4 cancer, we finally declared that her cancer is cured. There is no cancerous cell in the body. Proved it by scientific tests, proved it by all the tests that are possible. And in 15 days time she died. You know why? Not because of the cancer. Her husband divorced her. How do you take that? इसीलिए जितना फिजिकल उतना मेटाफिजिकल. Unless we understand that, हमने जंगल से पढ़ाई की है. MBBS मैंने जमशेदपुर से किया, झारखंड से. While I was doing my internship, I must have seen more than 100 patients सांप के काटे हुए. 100 में से 97 मर जाते हैं. 97 people die. Out of the 97, one dies of snake bite. One dies of snake poison. Rest 96 die of fear. So how do you deal with that? Fear will not produce anything. At the moment, it will produce death. So unless these things are taken care of, by making a drug, by making this, by giving this diet, we need to have an overall understanding of the disease process. Unless we have that, we will not be able to do anything for any disease for that matter, including cancer. So, failure of apoptosis, mitotic pathology. Mitosis is physiology. If mitosis becomes pathological, it's called mitotic pathology, and that is what is cancer. Next slide, please. So, war on cancer, we already mentioned. Next slide. The three-pronged approach, surgery, chemotherapy, radiotherapy, we just mentioned, they are not enough. They are not enough. In fact, if you ask me in a scale of 1 to 10, are they even 1? I would say no. I would say no. Because by doing these, we are basically harming the patient. I'll prove it to you how. I'll prove it to you in the coming slides. How surgery, how radiotherapy, how biopsy, how chemotherapy is harming the patient rather than helping the patient. Now, one thing which we all should know, why did cancer happen? So, the nearest explanation in one minute that can be given, which could be preventive for people gathered here also, because you must be having relatives जिनको आप ये पास ऑन कर सकते हैं मैसेज, बिकॉज आज के दौर में ये मैसेज देने वाले लोग भी कम हैं, बिकॉज वी इंटरैक्ट विद रेस्ट ऑफ द वर्ल्ड. मेनी पीपल आई इंटरैक्ट विद, आई डोंट सी एनीबडी गिविंग सच मैसेजेस. इट्स सो सिंपल. If your life is of say 100 years, if you make your life bonsai for one day, suppose your life is for one day only, which means what? When you got up in the morning, life started, and when you slept, life ended, isn't it? From the time you get up till the time you sleep, you make acid. Whatever you do, you make acid. Even if you're thinking something, acid is being made. If you're eating something, gastric acid is being made. If you're exercising, lactic acid is being made. Now, throughout the day, the body gets overwhelmed with the acid, so body has to take out this acid. So body is in an acid-base balance. How does it happen? How does the body do it? Respiration, perspiration, urination and defecation. These are only 4 ways how acid can be taken out of the body. And by being modern, what are we doing? We are blocking these pathways. Respiration, ऐसे सांस लो कि दूसरों को पता ना चले. So then you'll be breathing shallow. You're making more acid. That is why deep breathing in yoga is called alkaline breathing. Because you are taking out acid. By doing yoga, you are taking out acid. By breathing deep, you are taking out acid. That is why you feel good. Respiration. Perspiration, बड़ी गर्मी है, AC ऑन करो, पसीना रोक लिया आपने, एसिड निकलना बंद हो गया. ट्रस्ट मी, अगर एसिड नहीं निकलता है तो अंदर में डिजीज कॉज करेगा. निकालना जरूरी है. Respiration, perspiration, urination and defecation. Most of the people that you will meet of cancer patients, 99.99% will have a problem of acidity and constipation. It should give you a message. The message is, it's an overwhelmed acid. So what happens is, when the body gets overwhelmed, this will not happen in one day, this will not happen in 2 days, it's not going to happen in 10 days, not even 10 years. But if you overwhelm the body again and again every day, the body gets overwhelmed and this acid body इकट्ठा करके कहीं ना कहीं फेंकती है. अगर गॉल ब्लैडर में फेंक दिया तो वहां स्टोन बन गया, किडनी में फेंक दिया तो वहां स्टोन बन गया, ब्रेस्ट में फेंक दिया तो लंप बन गया, उस लंप में ब्लड सप्लाई चालू हो गया तो कैंसर हो गया. सो इट्स वेरी सिंपल. It is an acid-base disbalance. Just correct your acid-base disbalance to look younger. If suppose somebody was, I am working on Kaya Kalp. So, if suppose a 70-year-old person wants to look 20, it's possible, maybe not now, but maybe in the next 1 to 1.5 years, we'll be ready with many things so that Kaya Kalp संभव है. ये विद्या भारत से लोप हो चुकी थी, ये थी विद्या यहाँ पे, ये लोप हो चुकी है. एनीवे, सो कैंसर एज अ जेनेटिक डिजीज ऐसा हमें बोल के डराया गया था, इसीलिए एंजेलिना जोली ने अपने ब्रेस्ट कटवा लिए. मेरी माँ को था, उनको भी ब्राका जीन्स था, मुझे भी ब्राका जीन्स है, मेरे प्रोजेनी को भी होगा, तो चलो ब्रेस्ट ही कटवा लो. डज दैट सर्व द पर्पस? Was it the right thing to do? Did science come to help her? No. No. Like, for example, I'll give you an example of how genes function. Today, if you have a genetic disease, you think it is curable. How many of you feel it is curable? Genetic disease? You feel it's curable, sir?
Yes.
How?
See, it is, you have to understand it in a perspective, proper perspective manner. See, a totipotent cell like zygote can become a heart cell or a different tissue cells, so that there is possibility to revert it, epigenetically revert it to the original state of totipotency, so that you can achieve this state.
So that is what happens. If suppose there is cancer, the tumor markers that we do, what are they? They are the totipotent cell. Chorioembryonic antigen, CEA का टेस्ट होता है ना, उसका फुल फॉर्म है chorioembryonic antigen. So this antigen will only be present in the embryonic phase. If it is present today, which means it is cancer. So what are you talking about?
See, I have to explain it. It will take more time.
Okay, so I will come to your rescue and tell you that genes, being a genetic mutation or a genetic disease, can be loading a gun. The trigger is pulled by epigenetics. The trigger is not pulled by genetics. So even if the gene is defective, that is how we cure thalassemia, that is how we cure sickle cell anemia, that is how we cure all genetic diseases that you feel are not curable. We do it. You send a patient, you will see the result. So what we do is, genes might be defective. You change the environment of where the gene is, it will not be effective. Like, for example, to give you an example, next time if somebody asks you, sir, then that's the way you should give this example. Everybody will understand. You take a seed. Seed is programmed to become a tree. It is programmed. Nothing is required inside. The blueprint is already there to become a tree. What is required is the external soil. आप उसको डेजर्ट में फेंक दो, गल जाएगा. फर्टाइल सॉइल में फेंक दो, पेड़ बन जाएगा. Gene is like that. Genetic disease is like that. You change the environment, the gene is not going to manifest itself. So it might be the genotype, it will not come in the phenotype. And that is what we exactly do when we get a genetic patient. When you send a patient of genetic disease to us, इनके तो खानदान में भी था, इसमें भी था, इनके दादा को भी था, इनको भी था, भेजो ना बस. We'll see how we can reverse the disease process. And many times people call it miracle, we call it science. We don't call it miracle, we call it science. We call it an understanding of the disease process. जैसे last time pandemic में 60,000 patients कैसे बचाए हमने? हमने तो कोई ड्रग भी नहीं यूज किया, कुछ भी नहीं यूज किया, कोई आयुर्वेदिक ड्रग भी नहीं यूज किया. A simple understanding of the disease process. I'll tell you how. क्योंकि अभी और पैंडेमिक्स आने वाले हैं, तो इसके ऊपर 2 मिनट बात कर लेना बहुत जरूरी है. बिकॉज everybody should know, if suppose something like this happens again, what you need to do. The first and foremost is disease 2 ही तरह से होते हैं. Either the pathogen comes from outside or the inside cell becomes pathogenic. There is no third way of a disease to manifest. There is no third way. If there is any, I'll be glad to learn. So there are only 2 ways how a disease manifests. Either the pathogen is coming from outside or inside cell is becoming pathogenic, like cancer. And outside cell is the pandemic that happened, right? So if an outside pathogen comes, what will the body do? You think body will sit quiet? You think body is stupid? Most of the healing modalities feel that the body is stupid. Body will not be able to do it. We need to do it through drugs. Pause. You name one drug and you name one disease. This is the drug, this is the disease. This drug is taken and this disease is cured. You name it to me. You show it to me. You prove it to me. There cannot be a drug which can ever cure a disease. The cure will happen through the immune system. Drug, if at all it will do something, it will either enhance the immune response or slow down the immune response. That's it. So that is the value that you should give to drugs. Nothing more than that. You look at Ayurveda. Ayurveda is what? Today Ayurvedic physicians unfortunately कहाँ पे फंसे हैं? बस तुम्हारे पास तो पैरास्टामोल है, हमारे पास सुदर्शन वट्टी. Come on यार. Come on. Where are we? Where are we? Whole of Ayurveda, only 12 to 13% are drugs. Rest 87% of Ayurveda is the way you live. So Ayurveda is not a pathy. Rest are all pathies. And they're pathetic. Homeopathy, allopathy, naturopathy, all the pathies. Because they become active when there is a disease. Ayurveda is active throughout life. It tells you how to live a life. That is Ayurveda for you. So next time onwards, let's not discuss because तुम्हारे पास ये drug है, तुम्हारे पास ये drug है. Come on. We are degrading Ayurveda. So that is where we are as far as integrations are concerned. That is where we are as far as diseases are concerned. Pandemic की बात मैं कर लूँ. Because if there is any pathogen that is coming from outside, what will the body do? The body will raise temperature. Body के पास AK-47 नहीं है कि बस उसको ऐसे ऐसे करके मार दिया. Body will raise temperature. Why? To kill the pathogen. And where are we stuck? Temperature lower कैसे करेंगे? Are we helping the body or harming the body? Fever. फुंसी फोड़े आपके दोस्त हैं. अगर फुंसी यहां नहीं निकलेगी तो अंदर ट्यूमर बन के निकलेगी. अगर ये बात नहीं समझ में आ रही है तो फिर मुश्किल है. ये बहुत जरूरी है समझना. This fever is helping you, not harming you. What will maximum happen in fever? You are not going to die. You are going to get dehydrated. Hydrate yourself. That is what exactly we did. Next, what will the body do next? It will reduce the oxygen consumption. It will reduce the oxygen concentration. Why? Because the cells that are infected by the pathogen, what tool does the body have to kill? It will reduce the oxygen levels. What did we do? We gave oxygen. Are we helping the body or harming the body? Which is why so many people died. हमने क्या किया? शास्त्रांग कर दिया उसको. शास्त्रांग करवा दिया उसको. शास्त्रांग मतलब पेट के बल सुला दिया. एक और जानवर दिखा दीजिए जो पीठ के बल सोता हो. इंसान को छोड़ के एक और जानवर दिखा दीजिए जो पीठ के बल सोता हो. जब मर जाता है तब सोता है. हम रोज पीठ के बल सोते हैं और रोज सोचते हैं कि अमर तो हम ही है, बाकी सब तो मर जाएंगे. पेट के बल सोना या साइड में सोना is the rule of the cosmos and the rule of mankind. But nobody does that. And we expect 140 years of health. Why 140 years? Why 140 years? Why I am not saying 100 years? I don't agree with 100 years. I agree with 140 years. Anything in the cosmos, you cannot be an exception to the rule of the cosmos. The rule of the cosmos is anything that is born. The time it takes for maturity, it lives 7 times more than the age of maturity. You mature at 20. What is the reason you should not live till 140? What is the reason? It is we who kill ourselves. Oh, now I'm retired, which means you're telling the cosmos कि बस तुम्हारा कोई काम नहीं है देव में. कोई काम नहीं है. तुम, you are retired now. You go. Your time is up. How many people feel the cosmos is not powerful, or it is just ये तो सिर्फ कहने की बात है? Because I'll prove it to you scientifically. Cosmos कितना powerful? अभी I'll prove it to you right now. Okay, let me prove it to you. This is the last before we disperse for dinner. You raise your hand like this. I'll show you the power of the cosmos. Raise your hand, everybody. Raise your hand. So there are vertical lines here, there are horizontal lines here. You take this hand also and you make these two touch each other perfectly and then come back in a namaste. Do you see the fingers? Are they equal? Are they equal? Okay. So you want to, कोई भी हाथ, if you want to make your fingers grow bigger, जो भी हाथ का, you take it up, tell the cosmos to grow your fingers bigger in your mind 5 times. Tell them. Bring it back again. Where बढ़े? Where can he बढ़े? Where can he बढ़े? Do it again. It is not possible कि नहीं हुआ. The cosmos is that powerful. Whatever you say, ऊपर से तथास्तु होता है. It manifests. Okay, sure, it's going to happen. Which is why positivity leads to good health, and negativity leads to killing yourself. Thank you very much.